Hey everybody, we're going to sketch angular limb disease and we'll start off with a lateral perspective. So as usual, we have to get our orientation. So we're going to put the head screen left and there for cranial screen left, and we'll put the tail screen right and caudal be screen right. We're going to draw a limb from a lateral perspective, and we'll draw a normal limb and one with ALD. So we're going to keep this pretty straightforward, but we'll begin by drawing the distal humerus for the normal. And then we'll put in the radius distal to the humerus, and again this is the normal, so we're thinking, and this is very hypothetical, but we're thinking very straight, right? The radius is straight in the normal. And then we'll add the ulna. So we'll have our anchial process, our acromion, and we're making this nice and straight, as I said. Very hypothetical. We'll come up with our medial, and we'll finish off with our medial coronoid process. Boy, is that a nice antebrachium. One of the best I've seen. Now let's make a sketch for a dog with angular limb disease, and we'll start off with our humerus. And we'll put in our ulna, the acromion. We did the anchial process, and we're going to bring this down. And we get distal here. Let's put in first our medial coronoid process. If we get distal here, we're going to think that this distal growth plate in the ulna has become compromised, and therefore the ulna has prematurely stopped growing. Now, when we draw in our radius, we're going to think that as a result of this ulna stopping growth and the radius is still growing, you're going to get this cranial bowing, or this projection cranial, because it still has a functioning growth plate and it needs to grow somewhere, so it bows cranial. Now let's continue and make a sketch from a cranial view, and I'm drawing Butter, our French bulldog, so you can draw whoever you want. We're going to look at the face of the dog. We got to get our perspective down when we sketch. So we're looking at the face of our dog. And again, this is Butter. You can draw whoever you want. And we're going to put in a normal limb from a cranial aspect. And we're going to put in two limbs of a dog with angular limb disease. So for the normal limb, we'll just draw the right limb. For a dog with angular limb disease, we'll consider the right and left limb from a cranial perspective. So again, let's start off by putting in our elbow joint. These are just simple sketches, and our carpal joints. And we're going to add the metacarpals and bones distal to the carpal joint, and we're going to add the ulna and the radius distal to the elbow joint. And note that we're thinking of these, and we'll add the humerus. These are essentially in a straight line. This would be the static position of a normal, healthy limb. Now let's consider a dog with angular limb disease, and we'll put in the elbow, and we'll put in the carpus. Notice the carpal joints are more medial than the elbow joint. And then when we draw the bones distal to the carpal joint, we're going to make them project out laterally. So this is the valgus position. The bones are projecting out laterally from the carpal joint. And then the bones in the antebrachium, the ulna, and the radius, they're projecting medial. So that would be the varus position. And note, I'm also putting in that medial curvature of the radius, again, because of the growth restriction due to the premature closure of the ulna. So again, the bones distal to the carpal joint, which is medial, is referred to as valgus. And I always remember this as L for lateral, the lateral projection of the bones distal to the joint. So that's the valgus position. And then the antebrachial bones, the ulna and radius, are projecting medially from the elbow joint, and that would be the varus position.